And the research paper titled Factors Associated with Stigma Among Families of Leprosy Affected Persons. Leprosy is an infectious disease that can lead to physical disabilities, social stigma, and great hardship. Recent studies found that there was a high level of stigma among not only leprosy patients but also in the communities in Jaffna. There is a need to find out the determinants of stigma among family members of leprosy affected persons in Jaffna district. Why? Stigma often prevents early diagnosis and treatment. Understanding the factors that influence stigma among families is essential for strengthening leprosy control efforts in Sri Lanka. Reducing stigma within communities can improve treatment adherence, promote social inclusion, and support the Sri Lankan goals of achieving a leprosy-free Sri Lanka. This was our objective, is to determine the factors associated with level of stigma among family members of leprosy affected persons in Jaffna district. This is our primary data collection. Our study setting was all 14 MOH areas in the Jaffna district. It was a cross-sectional analytical study conducted with 80 family members of leprosy affected persons. We have excluded leprosy patients even though they are the family members. We have done our interviews in houses of leprosy affected patients in the community. Recruitment was from each patient's family. 2 available members were selected according to the descending order of the age. If fewer than 2 members in that family, recruitment was done from the next eligible family 3 members, which was our plan, but there was a major limitation. We have found 134 leprosy patients identified from all the records of MOH and RDHS Jaffna for past 5 years from 2012 to 2017, but we would be able to recruit 80 family members for this study because all family members in some families were leprosy affected, hence no family members in that family. Also, difficulty in tracing the old patients, some were shifted to other places as it is involved in 5 years data, and also the data collection period followed by a COVID-19 pandemic caused restriction and disruptions for our data collection. Though we have analyzed those with number of patients, we have used study instruments, a pre-tested interval administrated 15-item Likert scale stigma tool, which is EMIC, Explanatory Model Interview Catalog, stigma scale for others, and an interviewer administrated questionnaire. This EMIC stigma scale has been widely used and validated in various cultural settings and to assess the community towards some diseases including leprosy. It demonstrated cross-cultural adaptability and a psychometric strength suggests it can appropriately applied in Sri Lankan context with necessary cultural and linguistic adjustments. Thus, this EMIC was validated in Tamil in Jaffna by the principal investigator in another study. Ethical clearance was obtained from the Ethical Review Committee, Faculty of Medicine, University of Jaffna. Descriptive statistics and a chi-square test were used for analysis. The mean score of the previous study was used to decide the cutoff here to classify the level of stigma. Let's see the results. These are the basic socio-demographic factors of these 80 family members. 1/4 nearly male. Majority were Sri Lankan Tamil and Hindus. 65% have completed their secondary education. 70% are from MOH Chankane and 59% had no occupation. Average age was around 39 with standard deviation of 16. Let's see the level of stigma. We have divided into these 2 categories. Among the family members of leprosy affected persons, 41.3% has a high level of stigma based on the cutoff value of 10.25. Let's see the breakdown of this stigma stool. This is the EMIC tool we have used to assess the leprosy stigma of others. These are 15 items here. The purple color indicate the yes, that means they have the stigma. That means these family members are not discriminating their family members. These about others. Let's see some example these questions. Would people dislike buying food from persons affected by leprosy? Would you eat food from leprosy affected person? Would leprosy make a problem in getting marriage? Would leprosy cause problem in ongoing marriage? Leprosy people in community think less value than others, like kind of questions. So these are indicating the stigma level, and these highlighted two bars. You can observe the level of stigma was much higher. One is more than 80%, other one is more than 65%. Those are, would a person with leprosy keep others from knowing if possible? Would a family have concern about disclosure if one of their family members affected by leprosy? Those two questions. So we have done some association with chi-square test. The variable emoji area had the statistically significant association with the level of stigma with the p-value of less than 0.01. None of the other variables have associated with the level of stigma. So we conclude that a higher proportion of family members of leprosy affected persons had a high level of stigma in the Jaffna district. Emoji area of family members of leprosy affected persons had a statistically significant association with the level of stigma. With all the limitation in our mind, we can recommend that interventions to reduce stigma among family members in the particular emoji area at least are vital to eliminate leprosy in subnational level. A similar study with a larger sample is recommended. Thank you.
Thank you, Dr. Sugandha. Now we have about 2 minutes for any questions that you might like to ask Dr. Sugandha.
You have correctly identified the small sample is not enough and recommended. That's very good. My question is, now this, is it tallying with the previous studies? You are telling that now a particular emoji area people are more stigmatizing. And other factors, the usual known factors of stigma, none of them are significantly associated. And some of the factors that you have analyzed, I don't see any logic also. For example, now you have looked at the living conditions. How do you explain that drinking water availability, toilet facility, electrical facilities, all are connected to the stigma of a particular condition, this leprosy?
Those are not associated with the level of stigma, sir.
Yeah, but what is the logic of why you want to check those things? You can't check
based on the literature, the principal investigator has identified those variables. Also, it's a follow-up of his MD study, and he decided to check the association with the variables. And to answer your first question, whether there are any studies suggest these findings, yes, sir. There are two types of stigma. One is internalized stigma of patients, himself, and this is stigma of others. Almost those findings of his major study tallying with this small study of in regards to stigma of others.
particular emoji area, what is it?
Changana emoji area has the around 80%, even though it is less number, considering the disease leprosy, it is important. And 56 people, 70% are from Changana emoji areas. Already that is a pocket, small leprosy affected people are high in that area, which is also tallying with the finding, other finding. And they are continuing the screening and the programs in that area, but though it's still patients are there.
Thank you.
Thank you.
I just want to know who were the interviewers of your tool?
Interviewers, they are two interviewers, two data collectors. They have the basic degree of science. One is pharmacy and other one is agriculture. They are trained by the principal. I'm not the principal investigator. They are trained by the principal investigator, consultant community physician.
Because adequate training is essential in this
Yeah,
sort of a
they
tool,
have
right?
trained, sir. They were trained, sir.
Thank you, Dr. Sugandha.